Jai Swaminarayan, everyone, and a very warm welcome to this evening's BAPS Wellness webinar titled Does Blood Pressure Matter? So tonight's session is part of the BAPS Wellness Initiative, which is all about promoting lifelong health through 4 pillars, which are nutrition, exercise, sleep, and stress. The holistic approach is inspired by our gurus Pramukh Swami Maharaj and Mahant Swami Maharaj, whose teachings remind us to care for both the body and the mind. We're delighted to have you join us today. My name is Aarti, and with me here today, I have Tanvi Ben, Ashish Bhai, and Nirav Bhai. We are all GPs and also volunteer on the BAPS healthcare team. So tonight's webinar is on high blood pressure, also known as hypertension. Whether you're here for yourself, whether you're here for a family member, or simply to learn a bit more about your health, we're really glad you've joined the webinar today. High blood pressure is known as a silent condition because not many people can tell that they've got it, because you don't often feel the symptoms. However, over time, it can quietly increase your risk of having heart disease, strokes, and kidney damage. The good news is that high blood pressure can be easily treated, and there are ways that it can be detected early. And what we'll go through in tonight's webinar is how you can also adapt your lifestyle so you manage your blood pressure better. We will be recording the session today, and it will be available on YouTube afterwards, as well as our other webinars, which are already up on YouTube. And there'll be an opportunity to ask questions. So feel free to pop them in the chat, and then we'll try and address them at the end. We'll do our best to address them. So now I'd like to hand over to Nirav Bhai, who will kick us off by telling us what exactly high blood pressure is all about.
Thank you very much, Aarti Ben. And just around to everybody that's joined today, thank you so much for taking time out and listening to a webinar. I like to break things down, partly for my own mental sanity and trying to figure out what this all means, but also it makes it easier to digest and understand for people when they're trying to figure out what is blood pressure. Like Aarti Ben just said, it's silent. You can't feel it the majority of the time. So what exactly is it? And one of the best examples that I've come across is the example of a hose pipe, and it's something that we can all really relate to. We probably all have one at home. It can be turned on to maximum at the tap, and then whatever's coming out is the pressure that's in the pipe. Now, if you have ever been told to water the garden or clean the driveway, you're going to be aware that you can get the nozzles and or put your thumb over the end of it, and that can increase the pressure of the water, and so you get a faster, more powerful stream coming out. That is what high blood pressure is. You're getting an increase in the pressure of the fluid that's inside the tube. And we can imagine that in the same way as a hose pipe. You can make the hose pipe narrower, or you can increase the fluid through it, and that increases the blood pressure. And if you were to work on those same principles, you can also decrease the pressure by reducing the thickness of the wall or taking some of the fluid out. If we look at the screen at the moment, you'll see, imagine having that high power, high pressure force being sprayed upon, in this example, just a flower. What effect would that high pressure have to that flower? It would do far more damage than good, and actually can hurt the plant. But if you can see on the right-hand side of the image, a gentle, low-pressure stream can actually allow that flower to flourish and blossom and grow and be healthy. So both require the pressure to be there, but just not as much as sometimes we see that happens. Next slide, please. If I take you through that same analogy, Imagine you've got that high pressure pushing through the vessel, but affecting every single organ in your body. Now, we know we've got loads of organs, from your eyes to your heart to your kidneys, your liver, your lungs. And if we go to the smallest vessels in your body, the ones that are the narrowest already because the organs are smaller or they have really small endings, we're thinking about your kidneys, we're thinking about your eyes, we're thinking about the ends of your brain, and the smallest vessels inside your heart. These are the ones that are the most susceptible because they have the smallest vessels already. You increase the pressure further and you can cause real damage in those organs. So heart attacks, heart failure, stroke, dementia, vision loss and blindness, and kidney failure, unfortunately. And all of these are quite serious. And you know, if I told you that all of these could be significantly reduced, but by just reducing your blood pressure, we'd be thinking about blood pressure in a very different way. So next slide, please. What is it that we want to do? Now, we're going to hear a lot about lifestyle today, and we recognize that there is a huge role for lifestyle to play. And we will go through step by step how lifestyle can affect your blood pressure. But we can take it as given that there is a lifestyle component. A lot of people almost give up with high blood pressure and they say that my mum had it, my dad had it, my granddad had it. You know, I'm old enough now, so I've got it. But almost giving up is the wrong attitude. We want to focus on prevention. We want to focus on the lifestyle things that you can control. Don't just accept your genetics as that you will get something, but there are things that you can do, from salt to lifestyle to how much we're eating, to portion sizes, exercise, and maintaining a healthy weight. Even within our satsang mandal, there will be those that unfortunately still have smoke and take alcohol, and these things all push up your blood pressure. Now, there is another side to this, and many people either on this call or people that you'll know will have had to be medicated for high blood pressure. And it's really important for us to understand that this is one of the things that we do sometimes need to accept, that lifestyle can sometimes help us get a long way forward, but it can't always stop us needing medication. And if we do need medication, it's not to start and then stop after 4 weeks. It's to take ongoing, to bring that blood pressure down continuously. The way that works is by working on the same principles that we talked about with the hose pipe. You're trying to relax that tube, you make it wider and have lower pressure going through it. That can also be done by taking out some of the extra fluid, and that reduces strain on the heart. Occasionally, you might find that people have to use more than one medication, and that is possible. But that's not to say that you're losing or you're not doing the right thing. Each person is different, and it's really important to take the tablets if you are prescribed them the way that you are prescribed them. So to tell us more about the lifestyle bits and how we can bring nutrition into this, I'd like to hand over to Tanvi. Tanvi?
Just now, thank you, Nirav. So Nirav alluded to one of the first tools in managing your blood pressure being medication. But another tool that we often forget about is the food that we eat. In today's day and age, food is so easily available at all times. And so sometimes we eat because the food's in front of us, or because we've trained ourselves into thinking now is a time to eat, rather than just because we're hungry. But food should be used as a medicine to give us more energy, and to give us the vitamins and nutrients that we need. And so you should be able to tell quite quickly. So even if the lifestyle changes we talk about today don't quickly change your blood pressure over the next few weeks, these lifestyle changes do still quickly change the way you feel, in that you'll feel more energized, which in itself is a good reason to follow these changes. So when we're talking about nutrition and the impacts on blood pressure, one of the most obvious causes is having too much salt. But salt isn't just about what we use from the cupboard. It's also about the salt which is hidden in processed foods. Even simple things like packaged bread has a lot more salt than we imagine. Now, not everyone is super sensitive to salt. Salt doesn't actually increase everyone's blood pressure massively. And the hidden problem with blood pressure is actually sugar. Now, people often associate sugar with diabetes, but people who have a lot of sugar and therefore have insulin resistance, and so don't respond to the sugar or digest the sugar in the same way they should, because they've developed things like lots of abdominal weight, and they're on their way to getting diabetes or already have diabetes, those people are much more sensitive to salt than others, which means that it's not just the salt that we need to look after, it's also the sugar. And that also means that reducing our abdominal weight will also really help us with managing our blood pressure, because the more we lose our abdominal weight, the more our blood pressure comes down. In terms of what foods we should eat, it's all the foods that are helpful for all conditions. Lots of leafy greens, lots of nuts, fruits, seeds, and vegetables. Whole grains are also really helpful. And so it's about using lots of fresh produce rather than produce that no longer looks like it would do originally. For example, Maggi noodles looks nothing like anything that grows in the ground. And it's come a lot of steps to get to that, to get to what it looks like. Whereas eating whole grains and shak and all these kind of things look much more like the produce that grows from the ground, and so it's going to be less processed. Sauces and things like that, which are shop bought, are also processed. There's actually tools that you can use to identify which foods are processed, because the decision making around nutrition starts in the supermarket. And so we'll post those apps in the chat, and all you do is, as you're doing your weekly grocery shop, you use the app to scan the barcode for the food that you're shopping for, and it would give you a rough guide as to whether it's heavily processed or not. Next slide. As well as looking after what we're eating, it's also about how we're eating it, and simply moving after eating can be really helpful at managing our blood pressure. And Ashish Patel is going to tell us a bit more about exercise.
Thank you, Tanvi Ben. Suggestion around everyone. Thank you for coming. So yes, I'm talking to you about a very powerful tool that we all have access to. If I told you that there was a pill that could lower your blood pressure, strengthen your heart, improve your mood, and had almost zero side effects, you probably want that prescription. And that prescription's exercise. So why does movement, why does exercise help your body? How does it help your blood pressure? Well, if you imagine your blood vessels being like rubber bands, as we become older, as we become more inactive, those rubber bands become more stiff. Exercise allows those vessels to remain as elastic as possible. And when you move, your body produces chemicals that signals to those blood vessels to relax and open up, which in turn improves your blood pressure. At the same time, it also improves other parts of the body, namely your heart. A stronger heart means the heart can pump the blood with less effort, which in turn reduces the workload and reduces the blood pressure that flows in your vessels and your arteries. In fact, evidence shows that exercise, regular exercise, is as effective, if not more effective, as some medications. I believe it shows around, regular exercise shows a decrease of about 5 to 8 points on your blood pressure readings, which is phenomenal. So that's really a key kind of factor we should think about. And so I guess, how do we achieve this? What do we do? How do we achieve these gains? The guidelines say that we should be doing around 150 minutes of exercise a week. Now that sounds a lot, but if we break it down, that's around 30 minutes of exercise for 5 out of the 7 days. And And strictly speaking, it doesn't need to be complicated. You don't need a gym membership. You can incorporate exercise into your everyday life. So things like walking absolutely counts. We'd always try and say, it has to be of moderate intensity. How do we kind of gauge that? I kind of use the kind of talk test. So if you're walking or exercising, you've got to find it quite slightly difficult to maintain a full conversation. You've got to be a little out of breath. You shouldn't be able to do a kind of sing-song, if you will. And so that's what we should be trying to achieve. And again, I talked about 30 minutes, 5 out of the 7 days. You could even break that down further and do maybe 10 minutes 3 times a day. It can be, it is achievable. There is a, and don't underestimate things like, gardening, chair exercises, even dancing around the kitchen. It all kind of counts. And so the key thing here is about consistency. You've got to, just like we brush our teeth every day, you've got to be doing the exercise every day, and over time you'll see the benefits in your blood pressure. And I go back to it, exercise has lots of benefits. Another benefit, of course, is stress. And next slide, please. I'm going to circle back to stress in a minute, but I'm going to hand over to Tanvi Ben to talk about sleep and blood pressure.
Yeah, so sleep is a problem or sleep is a factor that people often overlook. And people don't realize just how important sleep is. A lot of people say that they sleep only a few hours a day or 6 hours, and they wake up feeling fine. They've been doing it for years. It's okay for them. But sleep is the time where our body uses it to regulate our blood pressure. And so if we haven't been sleeping well, so both sleeping enough and sleeping well over a period of years, it will put strain on our bodies, our blood pressure and our heart. And there's lots of evidence to suggest that poor quality of sleep leads to heart problems in future. And blood pressure is all connected to all of this. Sleep is also where we breathe slower. And unfortunately, some people also have problems with breathing. And there's a large proportion of people who have problems with their blood pressure who have undiagnosed conditions called sleep apnea. Sleep apnea is where is something you should be worried about, or something you should talk to your GP about if you're snoring a lot. Sometimes your partner may notice that you may hold your breath in your sleep, or if you're snoring a lot and you're particularly tired in the daytime and falling asleep easily, then that's a real concern, and you really should talk to your GP about it, because there's treatment for that, and a lot of people who start treating their sleep apnea find that their blood pressure lowers. The other thing linked to sleep is caffeine. Caffeine not only is a stimulant, and so it not only disturbs your sleep, but it also directly increases your blood pressure as well. And so that's something to look after as well. And also, if you think back to our ancestors, they would have only got less sleep if they were under extreme stress. So be that under attack, or there was a real reason not to sleep. And so when you're not sleeping, your body believes that you're under stress, and there's a reason why you need to stay up. And so when you're under stress, you need to increase your blood pressure to be able to act on whatever you're stressed about. We don't necessarily need to do that in this day and age, because the kind of things that we're stressed about don't need us to run a mile. And so then our blood pressure stays unnecessarily raised for prolonged periods of time. And so it's really important that we look after our sleep, which also brings us nicely on to the next factor which we need to look after, which is stress. Ashish Patel.
Thank you, Tanvi Ben. Next slide, please. So stress. stress is another really important pillar in good blood pressure control. And we often say I'm stressed casually, but biologically, stress is a physical event. When you're stressed, whether it's to do with traffic, family, work, your nervous system is releasing hormones that raise your blood pressure. Your body's entering a kind of fight or flight mode. These hormones kind of tell your heart to beat faster, they tell your blood vessels to tighten up, and of course, when your blood vessels do tighten up, your blood pressure increases. Now, of course, occasional stress is normal, but continual or chronic stress keeps the body stuck in this fight or flight mode continuously, and in our modern lives, we're often stressed more and more all day long in some circumstances. This keeps our blood pressure continually elevated, and our body never gets a chance to kind of reset or rest. In the current world we live in, look, we've got to be honest with ourselves. It's difficult to control or even eliminate stress, but the goal is to think about it differently. The goal should be about how we can help our bodies recover from stress. We need to manually switch our kind of nervous system from this fight or flight to a rest and digest kind of mode. And how do we achieve that? How do we go about kind of resetting our nervous system? Well, I see it in 3 key steps. I guess first thing is speaking to family and friends, sitting together, communicating, sharing our burdens naturally lowers our stress. Mindfulness and prayer, daily puja, mansi, pratna acts as very key kind of mindfulness practices, and it kind of centers our nervous system, gives it a kind of much needed break, and really important, just disconnecting. We spend a lot of our time nowadays in front of the screen, so trying to switch off. I'd always say trying to kind of turn off all screens an hour before going to bed. Turn off the news, put away the phone. The blue light keeps our brain alert, and maybe turning all that off and just relaxing and resetting really does help with not just stress but also our sleep as well. And if you're finding yourself overwhelmed during the day, the fastest way to signal safety to your body is through slow breathing. So breathing is really, really important. When you're stressed, if you take kind of short, shallow, quick breaths, but being able to kind of reset your breathing really does have a profound effect on our stress levels. So if it's okay with everyone, if it's okay with the group, I'd like to try a quick kind of breathing exercise, if that's okay. So if we all kind of close our eyes, sit comfortably on our seats, hands on our knees, and I want you to inhale through your nose for 4 seconds. I'll be counting 1, 2, 3, 4. And now exhale through your mouth for 6 seconds. 1, 2, 3, 4, 5, 6. Brilliant. And typically I'd like, it'd be great if you could do this for 3 cycles. That would be brilliant. And knowing when to do this, when you're feeling overwhelmed, when you're feeling stressed, being able to take a minute or 2 just to sit down, reset, do these breathing exercises for 1 to 2 minutes will just put a brake pedal on your stress and your blood pressure. Again, don't need to be perfect in doing this. It's consistency, it's recognizing your body, being mindful of when you're feeling overwhelmed, when you're feeling stressed, and knowing, kind of developing strategies that you can do and perform to kind of counteract that. Thank you.
Thank you, Ashish Bhai, and thank you to Tanvi Ben and to Nirav Bhai. I think we've learned a lot of small steps that we can take, in terms of what we eat, how we sleep, and we've just heard about the stress and we heard about the exercise before. So a lot of small steps we can take to improve our blood pressure. now what we're going to do is we're going to answer a few questions, some common questions, which will hopefully give you guys a bit more information about controlling and preventing high blood pressure. I'd just like to remind everybody, please do post in the chat if any questions pop up in your head. We will answer them after this short section. So to start off with, Ashish Bhai, what is considered a normal blood pressure?
That's a really, really good question. I'm sure everybody knows when they check their blood pressure, no two blood pressures are ever the same. And so I wouldn't start thinking about a normal blood pressure on just a single blood pressure. The key here is getting a set of readings, over a few days and taking an average of those blood pressures. Typically, personally speaking, I'd always look to do, a couple of two blood pressures morning and evening for 7 days. And taking an average and looking at that average, where you really want it to be is around 135 over 85, give or take. Ideal, however, is 120 over 80. But yeah, they're the kind of figures we're looking for. And remember, it's average, not single blood pressure readings.
Okay, so we're aiming for 135 over 85, but we should be aiming for that to be the average over all the blood pressures that we take. And Tanvi Ben, the next one is for you. Can we go through some of the common causes of high blood pressure?
Yeah, so there's lots of different causes for high blood pressure. They can be split into two categories. So there's those that we can control and those that we can't control. The ones that we can control are the ones that we've just spoken about. So the way we eat, the way we sleep, the way we move, and the way we manage stress all contribute towards high blood pressure, and our weight. Smoking and alcohol are definitely factors as well. And then there's those that we can't control. Things like our age, our ethnicity, and our genetics are harder to control. But just because you have a family history of high blood pressure doesn't necessarily mean that you will get high blood pressure. If you can manage the factors that we've just spoken about, then it should lower your risk or at least help you better manage it.
And Nirav Bhai, how often should we get our blood pressure checked? So how often should we check it?
Yeah, good question. The answer to that depends on a few factors. If you're well, healthy, haven't got any underlying medical problems, generally, if you're 40 or under, you might fit into that category. I appreciate there's a lot of people on the call, and that might not apply to everyone, but generally under 40, we would recommend you get it checked every 5 years. Then once a year after you're 40, just to double check that it's not going up. However, if during any of those readings, whether you're doing them yourself or going to a pharmacy or opportunistically using a machine that mum or dad or brother might have lying around, if you notice that it's going high, and that's after a few readings, and as Ashish said, 135, 85 or above, then we usually recommend doing a couple of things. So you can go to a pharmacy or your GP, and they can refer you for what's called an ambulatory blood pressure machine. So that's like a blood pressure machine stuck to your arm for 24 hours. It does a series of readings day and night over a 24-hour period. It's really accurate, and it gives a lot of readings, and tells us on average whether it's 135, 85 or lower or higher. Another way of doing that, which is a little bit more cumbersome, is to go for a home blood pressure reading, and it's just as clinically validated, so it's not a problem to do that, but you might have to do a bit more homework yourself. So you have to take the blood pressure yourself in the morning. We recommend doing it two or three times when you wake up, and then 2 or 3 times before you go to bed, and then write down the best of those readings and do that over a week. If you are, however, taking your medication for blood pressure already, then you might need to do that every year at least, just to make sure it's not creeping up. Unfortunately, even if your blood pressure is perfectly controlled, 120 over 80 on 2 or 3 medications, just as we get older, that number will creep up. So unless we're measuring it, we won't know if we need to adjust it or tweak it further.
Okay, thank you, Nirav Bhai. And one for you, Ashish Pai. If I feel calm and relaxed, does that mean my blood pressure is normal?
As mentioned earlier, feeling well, feeling relaxed doesn't necessarily mean your blood pressure is normal. Majority of patients with high blood pressure don't know they have it, and that's why it's important to get your blood pressure checked and monitored. That's why they call it the silent condition, because you feel the effects many years down the line through, cardiovascular complications, heart attacks, strokes, and things like that. So it's important that you are relaxed when you're doing your blood pressure to get an accurate blood pressure. You don't want to do your blood pressure when you've just come back from a run, or when you're very, very angry after coming home from traffic or something like that. But being relaxed doesn't mean your blood pressure is going to be normal. That's why it's important to always get it checked.
Okay, so it's really important to think about when you are actually measuring your blood pressure. So don't do it after, like, you've been running, or rushing around doing shopping or something like that.
Absolutely. As Nirav said, doing it in the morning, when you're relaxed, and doing it in the evening, typically a good time to do it.
Okay, fine. And Nirav, by one for you, can high blood pressure be cured?
In a word, no. There is a lot of research going into work on the kidney and laser treatments and things like that, but it's really small fry, and actually even they don't seem to be curing high blood pressure. What we are aware of is that blood pressure seems to be a condition where a lot of people will get it, may not know they have it, but they will get it. But it's something that can be treated and controlled, and I think that's the key. Your body doesn't care whether the blood pressure is 120/80 because of a med or because it's naturally okay. It just wants to have the blood pressure at that healthy, safe level, and where that blood pressure is up, it's important to control it. So as of today, we don't have a cure in modern medicine for blood pressure, but it is infinitely controllable.
Okay. Thank you, Nirav. And I can see lots of questions coming through on the chat about diet and, things to do with salt and sodium. So Tanvi, I'm going to kick this off and ask you a question. Is sea salt or Himalayan salt safer than regular table salt?
So when it comes to salts, there are different types. So you've got rock salts and sea salts, and then you've got table salt. And then you've got, you may have seen in the supermarket, there's some low salt alternatives. Sea salt, rock salt, and table salt all have sodium, and it's the sodium which is driving up our blood pressure. The table salt is more processed than the rock salt and sea salt. And the low salt alternative has potassium, which can help bring our blood pressure down. So don't think too hard about sea salt versus Himalayan salt. Just reduce your salt overall.
Okay, so all in all, they all contain sodium. So we've just got to think about reducing that sodium level.
Exactly.
Yeah. And you mentioned potassium. So just quickly,
Yes.
what is it about potassium that we should know about?
Yeah, so in the same way as some of Nirav's medication that he's talking about relaxes our blood vessels, potassium and some other vitamins can do exactly the same. And we can find these in fruit and veg, things like bananas. Potatoes, generally in our webinars, we don't advise that we eat lots of potatoes because a lot of us are having butter shack and doing egg yolks all the time. But for the occasion that we do eat potatoes, keep the skin on. It keeps potassium in. Lots of leafy greens, nuts, seeds, which also have a bit of magnesium, which is also really helpful.
Okay,
There is a craze for magnesium supplements at the moment, but evidence suggests that there's lots more evidence pointing towards magnesium in foods rather than the supplement, because when you have it in a food, you're having it together with the fiber and everything else that's good in the veg and nuts and everything else.
Okay, Fine. So, and I think in relation to what you told us about sodium, I'm going to quickly address the few questions in the chat that are related to that. So, one of them I will answer: how quickly can blood pressure be reduced with dietary changes? So, I think some research shows that if you reduce your sodium levels, as Tanvi Ben suggested, then you could even start lowering your blood pressure within a week. So it's that quickly that you will see those differences in your blood pressure. Another question that popped up, Tanvi Ben, I might ask you this question. What are the chief culprits for high sodium in our Gujarati diet?
I can see that whoever's asked that question has basically answered it for us. But yeah, they're all culprits. But I also think, as we mentioned, sugar is an issue with people who have high blood pressure. And some people say they don't have too many mithais, they don't have too much, they don't add sugar to their chai or whatever else. But remember that having rice every day, rotli, potatoes, all these things turn into sugar eventually. And so I'm not saying cut it out. Whenever we're thinking about diet changes, we should never think about cutting anything out. Think about adding good food to our diet rather than focusing too much on what we're cutting out.
Okay, yeah. So balancing out the good food rather than thinking what we should stop eating.
Exactly. Aarti, when you also said that you could reduce your blood pressure within a week if you reduce the amount of sodium. But for anyone who's thinking, I don't have much salt, think about whether you're having processed foods, and we'll drop the link to figure that out in the chat in just a second. But also, in the same way, lots of different things contribute to blood pressure. It will be, for some of you, it may be focusing on something else that will help reduce your blood pressure.
Yes, exactly.
Could I just come in? Could I just come in on that as well?
Yeah, of course.
There was another question in the chat that ties on to what Tanvi Ben just said. The foods that we eat are super important, and the question was, it's not just what you eat, it's how you eat it, and you know, we can't stress that importantly enough. Fiber and protein before carbs. It's an easy way of thinking about it. Having the fiber first, what that does is it slows down the sugar absorption, slows down the insulin spikes, slows and improves your insulin sensitivity. What that does on your blood vessels is that it improves what we call oxidative stress, and that's a technical term, but basically inflammation on the vessels, and that can lower your blood pressure as well. So it's all connected. It's never just one thing.
And when we talk about how we eat, it's not, it's also, are we eating with family, or are we eating in front of a screen? How many times are we chewing? Are we quickly eating between stressful tasks? Which links into what Ashish was saying. It's all really interlinked. Simply doing shlok and being grateful for the food you have in front of you can really help lower our stress levels before we eat, which increases the amount of saliva in our mouth. It preps us better to be able to digest our food. And yeah, will help all round. So it is, you know, what time you're eating also links to sleep, and whether we'll be able to digest it and how much sugar we'll take from the food. It's all really important. There's no one thing which will fix this. It's 100 little things.
Yeah, and I think that's what we're trying to emphasize, that all these small changes can make a massive difference to your blood pressure. I'm gonna try and answer some of the other questions from the chat by asking Ashish one question. So Ashish, can I stop taking my medications once my blood pressure is normal?
No. So we get these kind of questions a lot from patients, and the idea is that your blood pressure's got reduced to normal because the blood pressure medications are helping, they're contributing to the improvement. And so the worry would be, if you stop taking your medication, your blood pressure is only going to go back up. Of course, you know, it's always a combination between lifestyle, the changes you put in place with exercise, diet, stress, all that we've mentioned. But again, you know, stopping your medication it's not going to help, and it's only going to rise your blood pressure. So the advice is always to continue your medication, and any changes you feel might need to be made or anything should be discussed with your respective GPs.
Yeah. So if you're on medication, you should be taking them as your GP's prescribed to you. If you are on quite a lot of BP tablets, and I can see one question that's come through, how can you reduce taking those tablets? I think we've been through quite a lot of tips. So all the tips to do with your nutrition, all the tips to do with your exercise, getting a good amount of sleep every night, and reducing your stress, all of those things will help you reduce the amount of tablets you're on. So, if you make small changes to each of those categories, then you can reduce the amount of tablets you're on. And then linked to that, so if your blood pressure is controlled, say you are on the tablets and you make all these small changes and your blood pressure is controlled, do you still need regular checkups, Nirav Bhai?
So, like we mentioned earlier, blood pressure will creep, and it'll continue to creep up just by existing and by getting older, and we all will do that. We know every 10 years your blood pressure will probably go up by about 10 millimeters anyway. So even if you think it's well controlled, you can't tell it's well controlled until you put the cuff on your arm. And it may not be that you have to necessarily go into your doctors. They may just need to know what the numbers are. So as long as you're measuring it and letting them know, that might be enough. But always just seek advice with your GP, because some of the blood pressure medications require some blood test monitoring as well. So it can vary which one you're on.
Yeah, so just check with your GP.
Just check.
And we had one question come through. Do the doctors always do ambulatory blood pressures before prescribing medications? Ashish Bhai, you want to take that one?
Yeah, really good question. So I guess if someone's a new hypertensive, a patient who doesn't have blood pressure or history of blood pressure, and we find that their blood pressure is elevated, if it's really high, if their blood pressure is really high, then we sometimes would look to start medication. Of course, you hear this white coat syndrome, and so we have to take it, on a case-by-case basis. But typically speaking, we would always like to do an average of blood pressures, as mentioned earlier. We don't like diagnosing someone with blood pressure as a knee-jerk reaction to a single reading. We want to get that data. We want to get a series of numbers and making an assessment with that. And that's why we have those ambulatory blood pressure monitors that we install put in place for 24 hours. You have the option of doing the blood pressure, monitoring at home. And that's how we typically would diagnose blood pressure. Those patients who struggle with kind of white coat syndrome, and they know, patients know, that their blood pressure is always elevated in the hospital or the GP, I'd always encourage them, those patients, to do their blood pressure at home, a few times before the appointment, and come with the numbers. And so, you've got something to go with before you come with the appointment. You can hand it to the doctor, and it just helps the doctor rationalize any high blood pressure readings in the consultation room.
And you mentioned the home blood pressure monitoring. So linked to that, if you are doing it at home, then and you are already taking blood pressure medications, how long after you take your tablets can you measure your blood pressure?
I'd say about an hour at least.
An hour? Yeah,
so,
okay,
so
that's fine.
having taken your meds an hour afterwards, એક વસ્તુ કેવા જેવી છે, આજે ઘરે બ્લડ પ્રેશર કરીએ ત્યારે ઘણો બધો ફાયદો થાય છે, કારણ કે આપણે શાંતિથી બેઠા હોય, આરામથી બેઠા હોય, સ્ટ્રેસ ના હોય, ટેન્શન ના હોય, ડોક્ટર સામે બેઠા ના હોય, અને એ બધી મનની જે કઈ સ્ટ્રેસ હોય એ ઓછી થઈ શકે. પણ જ્યારે ડોક્ટર પાસે જઈએ અને સામે બેઠા હોય ત્યારે અચાનક સ્વાભાવિક રીતે વધી જ જશે. બધાને થાય છે, થોડું થોડું તો થાય, અને અમુક જણને થોડું ના થાય, બહુ થઈ જાય. અને જેમ આશીષભાઈએ કીધું કે આપણું બ્લડ પ્રેશર 160, 170, 180 થઈ જાય તો ડોક્ટર કદાચ ઝડપથી દવા ચાલુ કરી શકે, પણ તમારી સુરક્ષા માટે, તમારી બેનિફિટ માટે. પણ આપણને ખબર હોય કે ઘરે 110 120 હોય અને શાંતિથી આપણે બેઠા હોય, ટેન્શનની એન્વાયરમેન્ટ ના હોય, તો આવી રીતે ઓછું હોઈ શકે તો ઘણો બધો આપણે ફાયદો કરી શકીએ આપણા પોતા માટે, કારણ કે એ આપણે જ્ઞાન એ ડૉક્ટરને આપીએ તે વખતે તો ઘણો બધો ખ્યાલ આવે કે આ તો વ્હાઇટ કોટ કહેવાય, કે ડૉક્ટરની સામે બેઠા હોય ત્યારે વધી જાય છે કાયમ. એટલે હેવિંગ દેટ અવેરનેસ, એ જાણપણું રાખવામાંથી બહુ ઘણો બધો ફાયદો થાય. પણ only if we are aware ourselves, આપણે પોતાને ખ્યાલ હોય કે આપણે કરવું જોઈએ તો ફાયદો થાય.
Yeah, thank you, Nirav. And next question. Some really good questions coming through in the chat, actually. What is the link between diabetes and blood pressure? Are you at extra risk if you have diabetes? And if you do have diabetes, what blood pressure should you aim for?
Okay, so there's a way that I tend to think about this when I explain it to my diabetic patients. Like Ashish Boy said, when you're born and you're young and you're healthy and you're fit, your blood pressure, so your blood vessels are going to be like rubber bands. They're going to be nice and flexible. They're going to be nice and bendy and like a hose pipe, basically. But as we get older, or we have high blood pressure, or we have diabetes, high cholesterol, these things are calcify the arteries, and they can make the arteries turn from what feels like a hose pipe to more like a vase. So if you dropped a hose pipe from standing height, it would just go on the floor. But if you dropped a vase from that height, you'd know it could easily smash and break and rupture, and that can cause big problems. So think of it in the same way as that oxidative stress, that inflammation that you get from having the diabetes, having the high sugar, calcifying, making those blood vessels hard. The same thing can happen from blood pressure alone, same thing can happen from diabetes alone. But if you have both, which is way more common in our community, you've got a double whammy, so you've got to work even harder. And if you happen to have the hat trick of diabetes, cholesterol, and blood pressure, you're really lucky. Also, you have to work really hard to bring it down.
Yeah, so I think it's really important to be mindful that if you do have all three, you've got to work that little bit harder. Yeah.
Exactly.
And the next question is for Tanvi Ben. Can you take alternative medication, so Ayurvedic medication for blood pressure? Are there any recommended supplements that might lower your blood pressure?
I love this question because I feel like we never think about Ayurveda or Ayurvedic treatment or an Ayurvedic lifestyle to prevent these problems. And so we live our whole life eating a Western diet. And even if you say, oh, by Rodli Napashak, if you're eating it every day, that is a Western diet. And we live a Western lifestyle where we're not doing yoga and not doing pranayama, which helps with stress management, until the point where, because of our Western diet and lifestyle, we now get prescribed Western medicine to help cure this Western lifestyle, and all of a sudden we want Ayurvedic tablets. It doesn't work. Do all of the Ayurvedic stuff to prevent getting the high blood pressure, the diabetes, and everything else in the first place.
Thank you, Tanvi Ben. And a quick question for Ashish Bhai. Will weight loss help lower BP sufficiently? Because I know you spoke about exercise before. So, you know, if we lose some weight, is that enough to lower your BP?
So typically when we're managing blood pressure naturally, it's usually, you usually need to make multiple changes. You know, one single change typically doesn't cut the mustard. Usually you need more. Now, to lose weight, you typically need to be exercising better, eating better. It depends on, you know, the key factors of that person's weight gain. There are lots of medications now that encourage weight loss, but significant weight loss will inevitably, yes, improve your blood pressure to a degree, but it might not get your blood pressure straight back to normal. You might still need to have some medication for your blood pressure. What does Tanvi and Nirav, what does the rest of the team think?
Yeah, exactly.
Agreed.
So having too much tummy fat increases insulin resistance, and which is linked to how sensitive we are to salt. And so it's really important to lose weight. And we, as South Asians, as Indians, unfortunately, the way we metabolize fat and metabolize food, we just accumulate a lot around our tummy. And so we need to be extra careful, because from the outside, we see there's lots of weight around the tummy. From the inside, you might notice that actually there's fat in the liver. There's fat around the organs, which can really contribute to other health problems. And so, no, I completely agree with Ashish.
So the weight loss will not just, but it will have lots of other benefits. Diabetes,
exactly,
insulin resistance, fatty liver disease, lots of other benefits.
Yeah. So I think we're all in agreement there. And just a quick question about high blood pressure that's diagnosed in people who are under the age of 40. Nirav, can I just ask you what happens if they are diagnosed at a young age?
So young patients who have high blood pressure are quite rare. And we're talking about much less than 1% of the total hypertensives, the total high blood pressure patients. But they do require more investigation, because they often have rarer causes, something that was often to do with the kidney or the adrenal glands. There's hormone changes. These are usually investigated by the hospital. But if you are under 40 and you've been diagnosed with high blood pressure, it's worth asking the question to your GP, do you think I need some further investigations as to why this is happening so young? And if those tests are done and they come back as normal, then it is unfortunately like the rest of the population who've got unknown but very common high blood pressure.
Yes, exactly. Thank you, Nirav. And one quick question just before we end, because I've seen a few questions pop up in the chat about this. What can be done about low blood pressure? I was thinking maybe Tanvi or Ashish, do one of you want to answer, or Nirav as well, whoever wants to answer this one. Tanvi?
Yeah. Okay. Yeah. So it depends when low blood pressure. Why are we thinking low blood pressure is an issue? I saw a question about something about the American numbers are different, and someone has been given specific advice to have lower blood pressure. Stick to your cardiologist advice. The 135/85 is generic for people who have no other problems and haven't been told otherwise. In other countries, sometimes they have lower targets. The way that targets are built up based on a lot of other things, not just because blood pressure is individualized. So we think that having a blood pressure higher than 135/85 will contribute to problems with your heart, etc., which is why we have that target here in the UK. But as we said, aim for lower. Now, there's no such number which makes us worry about very low blood pressure. What we would ask you to look out for is if you're having symptoms of low blood pressure, like dizziness, like feeling excessively tired since starting to take your medication, like feeling like you're going to fall, faint, all of these kind of things make us worry about having particularly low blood pressure. If you're not feeling those things, then you're probably okay. The other time we start to get a bit lax or a bit easy about how tightly we control your blood pressure is when you're getting a little bit older and you're at risk of falls. Then at that time, we also don't want you to have too low a blood pressure. So at that point, we may reduce some of those blood pressure tablets to increase your blood pressure so that you're not going to fall and you're going to be a bit more stable. The other thing is that if you're worried, can I take this medication? I'm feeling like my blood pressure has been a bit too low since starting this medication. I'm getting whatever side effect it is. Just speak to your GP or speak to whoever it is who's looking after your blood pressure, because there's always options. They can always reduce the dose or try a different medication, but they're not going to know to do that if you don't communicate that that's the issue that you're having.
Yes, so thank you, Tanvi Ben. We've got a lot of information there about low BP and the targets that you can aim for as well. And the important thing I think Tanvi Ben mentioned is, yes, listen to your cardiologist if they have given you a specific blood pressure to aim for. So I think we are going to wrap things up there. I would like to say a big thank you to Ashish Bhai, to Tanvi Ben, and to Nirav Bhai for speaking to us today in such detail about blood pressure and how we can manage it. I'd also like to say thank you to everybody that has joined in to today's webinar. I think we've got a really good response and some really, really good questions. So thank you so much for joining and asking all the relevant questions that are important for you to control your blood pressure. There is a feedback form, so if you do have time, we'll post the link in the chat, and if you could fill out the feedback form. And then the other thing to mention is that all of our webinars from the BAPS Wellness Initiative are put on YouTube. So if you go to the YouTube channel, you'll be able to see the past webinars, especially those that are on diabetes. We've done various webinars on different topics, so you can also have a look at those ones, and this one will be put on there as well. Thank you everybody, and Jai Swaminarayan, and have a good evening.